Hi, I'm Shockley with Thrive Christian Counseling, and this is Owen with the Owen Clinic, and we're going to talk about nutrition and mental health. And a lot of times we have people who come into our offices, and I feel they don't really value that the two are integrated, and so they're not considering that nutrition and the things that we put in our bodies and the way that we care for our bodies is impacting their mental health at all. And so for me, whenever I have clients in front of me, it is one of the first questions I ask. And how much sleep do you get? You know, what is your intake of food, regular intervals, what types of food? What does exercise or just getting your body moving look like? And sometimes the clients will come in and they really think that they're depressed, and depression is keeping them from doing all those healthy things. And so I really feel like the focus on the depression has to be integrated with how they're caring for those other places in their life.
The old saying is, what you put in will come out, is applicable to the things that you think about, the TV shows that you watch, the music you listen to, and the things that you put in your body. So if you're putting in a lot of fatty, unhealthy, destructive things, well, think about it. If you feel like you couldn't go run a race after you do something, you can see that there's a physiological response. Dr. Paul Meyer wrote a book called Blue Jeans, where he looked at the way that you crave certain foods when your body's asking for certain nutrients. It does play a role. Your body is even smart enough to say, hey, I need this. What's the difference between a vitamin and a medication? Well, really, I guess what they're used for, but your body needs something, and when you put it in, it reacts better, and your brain is part of the body.
Yeah, there's a lot more mental clarity in clients that I see that are learning what those healthy ways are to, put nutrition in, but also to exercise their bodies. And so when, we're struggling with depression and anxiety, it is always part of my treatment to figure out how do I help my client to understand how nutrition plays a role in their mental health.
Nutrition, like let's say hypothetically, one of the symptoms of depression was a decreased appetite. So if I'm eating less, your body might be telling you something. If you do only the things you feel like doing when you're depressed, you're gonna stay depressed. Or if I don't eat, my blood sugar goes crazy, and then I yell at my kid for making noise in the back seat. That doesn't even particularly bother me, but I'm hungry, and you won't like me when I'm hungry. The body wants nutrients, and the body will tell you, hey, a little sugar here would go a long way, or a little bit of caffeine. There's a lot of ways that the body says that nutrients work together.
So Kevin, nutrition and mental health are pretty integrated.
Yes.
Yeah.
That have to be. And if you want to learn more about that, if you want to talk to some counselors who have studied both some nutrition things and some counseling things, well, Thrive has a bunch of counselors, and we have a bunch of counselors too.